Good evening, doctors. Welcome again. Today we are going to discuss about syphilis. This is very high yield and very important topic. And today in my OPD, I found a patient who is suffering from tertiary syphilis, a relapse case. Very dangerous. So let's start discussing about syphilis. Syphilis is a sexually transmitted infection which is caused by bacteria named as Treponema pallidum. It is transmitted by the root is sexual transmitted during intercourse. Sexual intercourse. Four stages. It include primary, secondary, latent, and tertiary. And I have a patient in my OPD that is suffering from tertiary syphilis. Shodin and Hoffman, the first to identify that treponema was caused syphilis, that is Shodin and Hoffman, scientist. Wasserman described it diagnostic test. Wasserman. So hope till here it's clear. Two forms of syphilis, acquired and congenital. Acquired is transmitted by sexually transmission. Congenital is transfer from mother to fetus through placenta. Transplacental spread. So hope this page is clear now. Sexually acquired infection. Etiological agent is Treponema pallidum. Disease progress in stages may become chronic without treatment. If we are not going to treat this syphilis, then it converts into chronic. Now about primary syphilis. This is painless ulcer, or we can say chancre rash, 2 to 3 weeks of infection, mouth, anus and vagina, throat. We see such rashes. 4-6 weeks disappear without treatment, infected to healthy. If infected patient have intercourse with a healthy patient, then the contact cause the primary syphilis. This contact causes the primary syphilis. Let's see. This is a chancre, painless on penis. This is a chancre, primary syphilis. On tongue, this is primary syphilis. See, primary syphilis. On genital region, see this kind of chancre. So this is painless and primary syphilis. Now about secondary syphilis, primary not treated. When primary syphilis is not treated, then few months secondary occurs. That is palm, sole, skin, mucous membrane, rash with flat raised passage, fever, loss of appetite, fatigue, pain in bone and joint. We see in secondary syphilis. See the picture of secondary syphilis. This is a case of secondary syphilis. On legs is a picture of secondary syphilis. Genital, mouth, legs, secondary syphilis. These are the secondary syphilis. On tongue we see secondary syphilis. Let's discuss about latent stage. This is lack of symptoms. Sometimes there is no symptoms in early latency. After secondary it occurs. Damage brain, heart, sexual organs, not feel till not reach the last stage. Okay, sometimes symptoms appear in last latent stage. Okay, now tertiary stage, and I have a patient with suffering from tertiary syphilis. It takes 5 to 50 years symptom appears, but in this condition in my OPD the patient already took the course of penicillin, but that patient is irregular, never go on follow up after the treatment, and after 15 years, a lady patient, 15 years back, she took a treatment of syphilis, even 3 doses of penicillin she took 3 weekly regarding tertiary syphilis, like, and but after that she loses the follow up, and now after 15 years she has tertiary syphilis detected by me. It causes paralysis, blindness, loss of coordination, gummatous syphilis, late neurosyphilis, and cardiovascular syphilis. Okay. See how dangerous this is, tertiary syphilis. See such, so danger. Tertiary syphilis very dangerous. See, these are the case of tertiary syphilis. Tertiary syphilis case. So this is a case of tertiary syphilis. Tertiary syphilis. Also a tertiary syphilis. also a picture of tertiary syphilis. Now, how to diagnose? There are two tests, non-treponemal and treponemal confirming use protein. In non-treponemal screening, don't use proteins like VDRL, venereal disease research lab test, and second one is rapid plasma reaction test. It's fast RPR, and treponemal palladium hemagglutinin assay test, fluorescent antibody absorption test. What was the difference between TPHA and FTA antibodies test? That is fluorescent is used here. So in that lady, this is present positive, 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 positive. All are positive, guys. And if you want to confirm the diagnosis, then we need to go for dark field microscopy. Cervical swab, spirochetes are visible. Now, direct identification of treponema palladium by dark field microscopy, direct antigen detection test, nucleoside amplification technique PCR. Serological test to detect IgG, IgM antibodies, non-treponemal test for determining the disease and activity, treponemal test for disease and confirmation, detection of treponemal IgM antibodies to detect early infection. Okay. Now, about treatment. How to treat by antibiotics, longer therapy, Jerick-Hexheimer reaction. In primary and secondary syphilis, we need to treat with benzathine penicillin G 2.4 million units intramuscular single dose. Primary and secondary. For early latent syphilis, 2.4 million units intramuscular single dose. For late latent syphilis, 7.2 million units, each dose of 2.4 million unit 1 week interval. Now, 14-day interval of ceftriaxone, early syphilis, doxycycline and tetracycline for 28 days. Hope till here it's clear. Now, incubation period of average time between infection with syphilis and the start, the first symptom is 21 days but can be ranged from 10 to 90 days. Syphilis blood test result will be negative during this time. Now, incubation period, that is duration 3 weeks, since transmission directly proportional to the size of inoculum may vary 3 to 90 days, absence of clinical manifestation. Primary syphilis 6 to 8 weeks after incubation time. Secondary syphilis 2 to 5 years after primary syphilis. Tertiary syphilis during years after secondary syphilis. Latent syphilis, absence of clinical manifestations, positive serological test. Now, tertiary syphilis therapy is benzathine penicillin 7.2 million units, total administration 3 doses, 2.4 million units intramuscularly each 1 week interval. Penicillin allergic, those who are allergic then go for doxycycline 100 mg oral twice daily for 28 days, or tetracycline 500 mg orally 4 times daily for 28 days. Okay. Early syphilis, benzathine penicillin 2.4 million unit intramuscular once. Procaine penicillin is 6 lakh units intramuscularly daily for 10 days. If the patient is unable to take penicillin, then give tetracycline or erythromycin 500 mg 4 times a day by mouth, or doxycycline 100 mg twice for 15 days. Ceftriaxone 2 gram QID IM IV 10 to 14 days is a new. Now, primary secondary syphilis, re-examine 6 to 12 months. That's why I tell in my patient she is not re-examined and she is irregular or never been after that situation. So that's why she is converted into tertiary. Latent syphilis 6, 12 and 24 months. And HIV infected patient 3 months, 6 months, 9 months, 12 months, 24 months for primary or secondary syphilis. Follow up. Neurosyphilis serological testing as above. Repeat CSF examination on 6-month interval until the normal. So guys, I hope till here about the syphilis is clear for you, and if you have any queries, any question, you can ask me. And if you still not subscribe my channel, please subscribe it. If this disease is not treated properly, that means it is a dangerous, life threatening and very very bad. So guys, if somebody or anybody who suffer from this disease, they can, if they have any queries, question, they can ask me. And those students or doctors, those who are studying about this disease, if they have any queries, any question regarding this lecture, they can ask me. And if you still not subscribe my channel, please subscribe it. Thank you, good day and goodbye. That's all.